Probably wondering how I got here. I'm dead. Doctor, I've been coughing up blood for the past 6 hours. I have the chills, I can't breathe, and I just hurt all over the place.
It's gonna be okay, Nate. It's gonna be okay. First of all, we just have to run some blood tests and probably a physical, see what's going on with you.
It wasn't gonna be okay. I died.
So during the physical, I found that the patient had hepatosplenomegaly,
What the hell is that?
or increased swelling in the kidney and the liver,
Oh, okay.
and inspiratory crackles in the lower lungs, indicating that there was blood in his lungs. What did the blood test show?
According to the test, the patient tested positive for anti-glomerular basement membrane antibodies in the blood. However, the serum complement levels were normal. This is indicative of good pasture syndrome, which is a disease that causes the immune system to attack the kidneys and the lungs. And in addition, we identified an increase in white blood cell counts and iron deficiency.
Considering the patient has good pasture syndrome, we should administer a drug treatment of azathioprine and trimethoprim plus sulfamethoxazole for 3 times a week. This should be able to clear everything up and keep it normal.
Bullshit.
However, if we don't monitor it closely, it could progress to chronic renal failure. What do you recommend for his exercise plan?
For his exercise, I would suggest any continuous activity, such as walking or biking, swimming, any outdoor activity. The most effective types of exercise for him is those utilizing large muscle groups. He should also limit his duration to about 30 minutes, 3 to 5 times per week.
Fortunately, your symptoms are getting worse. We found indications of proteinuria and hematuria. So we're going to have to administer methylprednisolone, azathioprine, and plasmapheresis in higher dosages.
Yeah, so essentially, just more freaking pills. After my initial examination, I had to go to the doctor every 6 months for a total of 3 years. The only treatment that they were providing me was more and more pills along with the exercise program. I said screw the exercise program and took only about half the pills. I was feeling fine, but then my symptoms continued to get worse and worse. I developed swelling in my hands and feet. I coughed up blood occasionally. I struggled breathing and sleeping. Bottom line, I developed acute kidney failure or renal failure, which ultimately was my fault. I was wondering why they didn't put me on dialysis, but now I know dialysis was the last resort. Renal failure can be easily treated through the proper diet, exercise, and medication. Nevertheless, I should have been put on dialysis.
Yeah, Doc, I think we should put him on dialysis.
Me too. The dialysis would have helped filter those toxins out of his blood. I had hoped the medication, the exercises would have been enough.
It's a shame.
Well, in conclusion, Mom, looks like your son developed chronic renal failure from his good pasture syndrome, and his kidneys just shut down. He couldn't filter the toxins out of his blood. Come with me.
And that's the story how I died. Bottom line, renal failure sucks. On dialysis for life. No filter, no life.